We have two different airway adjuncts that we are able to use. One would be an oropharyngeal airway, or an OPA, and the next option would be a nasopharyngeal airway, or an NPA. I'm going to begin with the OPA. The indications for using an OPA would be a patient who is unresponsive, who does not have a gag reflex. If your patient has a gag reflex, this airway adjunct is contraindicated and you cannot use it. Now I'm going to go ahead and apply the device. So I'm going to start by measuring my OPA, measuring it from the patient's front teeth to the angle of the jaw. So then I'm going to take my cross finger technique, crossing my thumb and pointer finger like so. I'm going to place my thumb on my patient's bottom teeth, my pointer finger on my patient's top teeth, and then I'm going to apply pressure in opposite directions to open my patient's mouth. I'm going to grab my OPA, inserting it upside down, rotating it 180 degrees when the hard palate becomes the soft palate, making sure that flange rests on the front of my patient's teeth. If my patient gags when I insert this airway adjunct, I am going to immediately remove it towards the patient's feet. Next would be the NPA. Indications for using an NPA is when an OPA cannot be inserted, so if your patient has a gag reflex. However, if your patient has a suspected fracture to the base of their skull or facial trauma, this is contraindicated and you cannot use this device. To measure the NPA, we're going to measure from the patient's tip of their nose to the earlobe, like so. Next, I'm going to grab my lubricating jelly and lube the NPA before I insert it. I'm going to insert this NPA with the bevel towards the septum. In the patient's right nostril, it will just slide right in, like so. If you need to apply this NPA to the patient's left nostril, you're going to also insert it with the bevel towards the septum, but you will have to rotate it, just like the OPA, kind of 180 degrees, like so.